So we're really fortunate right now to have 2 approved ADCs for the treatment of metastatic hormone receptor positive breast cancer. We have Trastuzumab deruxtecan, or TDXD, for HER2-low breast cancer, and then Sacituzumab, which is also approved for metastatic hormone receptor positive disease. I think the challenge is that these 2 trials were done in somewhat different patient populations, because DESTINY-Breast04 had studied TDXD in patients who had 1 to 2 prior lines of chemotherapy, whereas TROPiCS-02 looked at Sacituzumab in patients who had 2 to 4 prior lines of chemotherapy. So they were much more heavily pretreated. And so we don't know what the optimal sequencing is, but given the data that we have right now, I do think if you have a patient who's hormone receptor positive and HER2 low, I generally would favor giving TDXD first. Again, that's what was studied earlier lines, and then sequencing that with Sacituzumab subsequently. If someone has a HER2 IHC 0 tumor, though, then I do give Sacituzumab in that case.